Good morning. Welcome, my trailblazers. Welcome to the 29th DigiPath Digest, where we explore the literature about digital pathology and medical AI. When you are here, when you join, let me know where you're tuning in from. And the chat is working. We're back to okay, I see you joining. Whenever you're here, let me know where you're tuning in from. I'm in Pennsylvania, 6 a.m., back from Park City. So let me give you an update while you settle into the live stream. We have coffee, the Polish cup. We need coffee at 6 a.m. I mean, I don't know if you do. I do. I just came back on, I don't know when, beginning of the week from the Lumea here. Lumea Digital Diagnostic Summit. You might have tuned in into the live stream, and they gave this beautiful mug or jug, and I put already the Digital Pathology Trailblazer sticker on it. I have the book to later offer you the book. I was supposed to work on it this month and finish the new version. And we have Scott from Atlanta. Scott, you're a regular on these live streams. Thank you so much for joining. So you're amazing. And I was preparing for this one because I skipped in September because I was supposed to be working on the book. We did two live streams where I was doing stuff on the book. And then when I was not accountable to you, I stopped working on the book. Not great. But what I want to tell you is that I was so excited to join you here live. And because you're amazing. And they're all about you being amazing that I want to tell you. I was City together with Imogen Fit, and we're going to go to Path Visions together as well. I'm going to tell you about my Path Visions appearance in a second. But I was streaming there, and we were talking about, all things digital pathology. And one of the things was that there is an image-based test, a stratification test for patients by AstraZeneca that assesses the membrane versus cytoplasmic staining of a specific IHC marker, TROP2, and I was like stumbling upon like which marker is that, and sure enough, in the second, there was exactly what the name of the marker was, what the name of the test was from a trailblazer, and that's why a huge shout out to you. And obviously, as I think, okay, how to create better content, how to create more content, how to create more podcasts for you. I was thinking of different formats. And the one that I enjoyed the most are these live streams. Later, my editor takes out all my rambling and all the audience interactions, and they become podcasts. So yeah, I'm going to be doing more of that, and I'm going to be doing that from Path Visions. So at Path Visions, I'm going to be there as a media partner. So thank you so much, Digital Pathology Association, for joining forces and being a media partner. And I'm going to be streaming from there. So if you see me walking around with my camera, if you see me walking or streaming, you can just wave and join me. I would love that. Don't be intimidated. That's what I do, but I do it for you. So if you want to join me on this side of the camera, whenever you see me around, you are more than welcome. Just, wave, and it's going to be our signal that you join. Or maybe we should have a special wave or anything. Just let me know. I'm there because I want to meet you as well. And we're gonna also schedule a lunch when you can join me. And obviously I have to do it today because I'm flying on Sunday, and you're probably already prepared and booked for dinners and everything. But I'm gonna send it out hopefully today in an email when we're meeting, probably Monday. I'm thinking lunch for Monday in some space where you can just join me. I'm just going to be eating there, and whoever comes, and we can hang out together. I would love you to join me. I'm going to be vlogging, of course, streaming, as I said, and of course, supporting the sponsors, the Digital Pathology Place sponsors. So I'm going to tell you later at which booth you will have the highest probability of finding me, because we're going to be recording a podcast with Mtuitive. There are going to be social media posts created with Barco, with Grandium, Probably I'm going to be hanging out around a Predia booth as well. Everybody who's a Digital Pathology Place sponsor, and definitely I want to meet them. I want to see them. And today's topic, let me know where you're tuning in from, but today's topic is, oh my goodness, something that when I have not seen a paper having so many press releases and being picked up by so many media sources. Let me cough first. Need to use some water. From the Trailblazer Lumea cup. Amazing summit by them. And I visited their lab. There's going to be videos, of course, and you can see it. So, but going back to the topic, which is AI a threat to us in terms of us as healthcare professionals, as basically professionals losing our skills? And everybody somehow under the surface, everybody, or let me just stick to me. Me having used Claude, ChatGPT, and a lot of these different tools, I'm kind of like pushing this to the back of my mind, but I'm actually asking myself, am I getting like lazy and stupid by using them? And I'm afraid that at least there is a partial yes to this question. So going back to the papers, let me share the first paper that we're going to be talking about. It's Endoscopist Deskilling Risk After Exposure to Artificial Intelligence in Colonoscopy, a multi-center observational study. I'm going to put it big in a second, but what I want to talk about is like how many media outlets picked this paper up. The first time, it's in Lancet. The first time I saw this paper, unfortunately my super pen doesn't work, so I'll have to do it with a mouse, like the drawing and stuff. But the first time I saw it was when I was covering the NCCN summit on AI in healthcare, and one of the panelists cited the Lancet paper, and he just showed the Lancet cover, and I'm like, okay, de-skilling of endoscopists, and it was part of discussion, right? Are we gonna get more skills because AI is gonna help us with something, or are we gonna lose the skills? And he cited this paper, and then I was talking to my husband. He's an MD, a clinical pathologist, and he says, "Oh, the study was published in Lancet. This is a study from Poland," and I'm like, first shock. How do you know about this study? I mean, he helps me out at Digital Pathology. He's actually Digital Pathology Place. He's my VP. But I'm like, you're like, I'm on top of these things. So I was surprised. Anyway, that's the first thing. And second, Poland. And I'm like, Polish paper? And I didn't cover it in Digipath Digest. So today we're going to be covering it. Let me make it big. And actually, two papers. It's not the abstract today. Paper is, where is my second paper? Okay, here's my second paper. Come on. The other one, it has the coolest title. I wonder if my years of training and expertise will be devoted by machines. I'm like, yeah, I'm wondering as well. Probably it will. And I'm going to give you, obviously, my perspective on this. But yeah, and the conflict is AI is being adopted rapidly and it promises huge benefits. And I'm taking advantage of it in terms of content creation tremendously. Like if people would take it away from me, I would be very sad and a lot slower. And I would have to like use my brain. It would be a lot more painful. So in this, today we're going to be looking at two key perspectives. One is the deskilling, and the other one is the concern of healthcare workers. This one is about the concern. It's from sorry, see, I don't have my pen. Open Nursing, and they applied psychological study methods to investigating, okay, how do healthcare workers feel about AI? So let's start with the first one. What's happening here? Is there Endoscopist deskilling risk after exposure to artificial intelligence in colonoscopy, a multi-center observational study. And this study is from Poland. Let me do this one. It is known, it is not known if continuous exposure to AI changes endoscopist behavior when conducting colonoscopy. So they assessed how endoscopists who regularly used AI performed colonoscopy when AI was not in use. And I like the study. Let me show you the methods. I like the study design very much because what they did is they had 4 endoscopy centers in Poland. And when I looked of course, it's not big, it's small. Nobody's telling me in the chat that this thing is too small for you to see anything. You must tell me in the chat, because then half an hour passes and you don't even see what I'm highlighting. So feel free to give me feedback in the chat. But I'm excited. 4 endoscopy centers in Poland, and 1 is in Gorzów Wielkopolski. And Gorzów Wielkopolski is, here, where is it? Does it say? Anyway, it's very close to where I live. I go shopping there. I used to go to English learning school there and to musical school there. So Gorzów is close to my heart. My sister went to high school there. So they conducted a retrospective observational study. And this was part of a bigger trial, Accept Artificial Intelligence in Colonoscopy for Cancer Prevention trial. And these centers introduced AI for polyp detection at the end of 2021. So this was a retrospective study, after which colonoscopies had been randomly assigned to be conducted with or colonoscopies with or without AI assistance according to the date of examination, right? And they evaluated the quality of colonoscopy by comparing 2 different phases. And this is what I like a lot. Maybe I can change the color here. And because they took the data from 3 months before and 3 months after AI implementation. So we have a long period, 3 months before they didn't know how to use it, and this was like the without AI, and it's going to be important because it's kind of a concern, like when measuring the baseline. So this was the baseline, and then they learned AI, and 3 months after implementation, they took away the AI, right? And they included diagnostic colonoscopies, and obviously they like did it as standardized as they could. And what they were measuring was the primary outcome was change in adenoma detection rate of standard non-AI assisted colonoscopy before and after AI exposure. So the adenoma detection rate is kind of like a measurement of success of colonoscopy. The higher this rate, the better they are in detecting these adenomas, which are supposed to be like pre-cancerous lesions. And what happened in this paper was that they did a lot of they colonoscopied a lot of patients, and a lot is 1,443. Let me just spell it out. And they underwent non-AI assisted colonoscopy before, 795 of them, and after. So both were non-AI assisted, but the second period was after the doctors were using AI. So they were already, using this tool, and it's a specific tool. I think they're mentioning it. So 648 was after the introduction of AI, and they give the data on the patients, and what happened here was there was a difference, a decrease of -6% of this adenoma detection rate. So the ADR of standard colonoscopy decreased significantly from 28.4 before to 22.4. So we have this 6-point decrease. Not great, but it gets worse even, you know. And if you have comments, anything that already like sparks some kind of turmoil in your head, leave it a comment, leave it something in the chat. This live stream is not going to be a prescription. Oh, do this with AI or do that with AI. And a pretty capable researcher conclusion, a lot more complex conclusion. So obviously easy for me and easy for human mind is to have like 5 different steps that when you follow, you're going to be successful. You're not going to get that from this particular pod or live stream. But let's continue, right? So what did they conclude? They concluded that continuous exposure to AI might reduce the ADR. So obviously this was an observational study, in my clinical trial. So it might reduce the ADR of standard non-AI assisted colonoscopy, suggesting a negative effect on endoscopist behavior. And why do they think it suggests, and what kind of behavior, right? So that kind of supports this conclusion is when endoscopists were using AI, there was this eye tracking movement done, and they were using their eyes less than without AI. And they basically, and I can imagine this as any like computer aided diagnostic. Basically, like you get something highlighted, you go, you confirm. And if you have a confirmation, this is your diagnosis. So basically you're done. At least in pathology, right? You have focus. Let's say I look at the slide and you have a focus of neoplastic tissue, right? There is your diagnosis. You can already say this is cancer or what that is, right? This is inflammation, this is whatever. And you don't have to go and search for more of it. I mean, if you want to grade it and describe, that's fine, but you already found your answer. So if you have an AI assistant pointing you to that place, then logically you're going to be using your eyes less. So kind of, you know, stuff is logical but also concerning. So that's why no five-step framework to avoid getting less, right? 5-step framework to avoid getting stupid with AI. And no, we don't have that. Okay. But moving on. So they might this might suggest a negative effect on endoscopist behavior. And like if you Google this deskilling, like go now and Google this, you're gonna find like so many media outlets in the medical space picked this paper up. And I'm so proud it was in Poland. Let me show you a few graphs from this one. I'm gonna make it big. So very thoroughly, like they characterized everything. They did the multivariate. They have one graph that exactly says what it was. Yeah, logistic regression analysis to identify factors affect detection rate, and they used like everything: sex of the patient, age group of the patient, adequate bowel preparation, and incomplete examination. Yes, no, sedation, and also sex of the patient are like they're known to have a higher adenoma detection rate, right? So they account, right? Was it or was it surveillance specialty? Was it physician surgeon? I wonder which one was in Koshov. And also the endoscopy sex, and what they found out, and there is more data needed on this, that even though there were, so they had 19 endoscopists in total, and and the females dropped not by 6%, by 15 when the AI was taken away. So obviously they are not making any conclusions, but definitely there is a lot more like psychological, behavioral research that needs to go into the interactions with AI of healthcare workers to figure out, okay, how do we mitigate? Because, okay, let me show you a few more graphs of this one, and then we're going to move on to the next one. And let me know if you have questions. Let me know if you have comments. And what are your thoughts? Are you like scared? Are you thinking, oh, we'll figure it out? Are you thinking, let me read some more? Just give me a reaction in the chat. What are your thoughts to this? And also let me know where you're tuning in from and what time it is there. It's 6:20 here in Pennsylvania. So they did this. Also, I made here, this was the 28 original before AI introduction, and then we had 22 more or less. Apologies for my and my dots. This was after AI introduction. And here endoscopists, they only have 15 here because they excluded, I think, the ones that had very little experience. But look, 4 of them were better, and the rest was worse. And somebody was like very bad. I would not be that person. It's anonymized. Nobody will know. Of course they know. Okay. Anything else I wanted to show you here in this one? Yeah. So that's the deskilling problem, right? That is one of our problems. But as we all know, or maybe not, but some of us know that we tried to change something in an institution, that change management is difficult. And whenever a new technology is introduced, there is a level of resistance to it. And I keep hearing for digital pathology, AI in medicine, there is always this question popping up, and I thought it's going to like stop popping up, but it's not. And it is, okay, is AI going to take away medical professionals, as scientists, as, contributing to healthcare, maybe whatever, right? Is it going to take away our jobs? And there is like this saying or slogan, no, it's not going to take our jobs, but if we don't know how to use AI, then we are going to be replaced by people who know how to use AI. Although now after the deskilling papers, like, those who know how to use AI, when you take away the AI, it's going to be even worse. But again, food for thought here about other technologies, because before we dive in, this other paper is, okay, I was thinking about it, and I'm like, I know how to drive a stick. I'm from Poland. I know how to drive a manual, what is this, gears in the car. And I drive it in Poland, and I'm thinking, and I spend now more time in the US. I have an automatic car here, and I was thinking, okay, am I worse doing this, driving the stick in Poland? And when I focus, I'm not worse, but I'm used to not having to focus so much. And let's keep it vague so that, I don't want to disclose like how unfocused I am driving online. But my friend does that. Let's talk about my friend instead. So my friend, she knows this, how to drive a stick, and she also most of the time she spends driving an automatic car. And when she gets into the car in her country of origin, where she drives the stick, she is used to being able to be a lot more distracted. Like bad habits. I hope she stops doing this. but picking the phone and doing some stuff on the phone, right, while driving is prohibited in her country. So she should not do that for sure. And she's not going to be doing that because I'm going to talk to her. But that, like drinking stuff, anything, she knows that when she drives an automatic car, she can afford to be less focused. Like subconsciously, right? It doesn't impair the driving. But when you're driving the stick, of course, it does impair the driving. So that's one thing. She didn't really get de-skilled, but she did get defocused. Another example, my friend relies on Google Maps. When Google Maps was not a thing and the GPS on the phone was not a thing, she would use a map. She still knows how to use a map, but she's a lot slower, and she actually doesn't have to use a map. Like I remember, okay, let's go back to myself. I remember when I was trying to get to one, like some remote place, when I was doing my vet. We had to do some kind of internship, and one was a slaughterhouse internship as a veterinarian. This is a mandatory thing, and the slaughterhouse was like in the middle of nowhere. And I remember like stopping at every crossing, consulting this map, and picking up my next turn. Like I hope I never have to do it again. Or when I was little, and I would have the map, and my mom was driving, and I would have the map, and I would guide her. Like no, we don't have to do it. I still know how to use the map. And Google Maps, kind of, you have to understand how it works. But these two examples came to my mind when I was thinking, like, am I really getting worse at the stuff that I have assistance with? And in a way, yes. Does it matter for these tasks when Maps is ubiquitous? 99% of the time, so it doesn't really matter. This 1% of the time, I don't know. I will probably call somebody who has Google Maps who can guide me or something. But enough rant to the paper. Our next paper is my years of training and expertise will be devalued by machines, because the examples I gave is everyday convenience. Not even as a professional driver do you have to worry whether it's a stick or not. The car that you're supposed to use for your driving, then that's the car you're going to drive, and you're going to learn whatever that is, right? But the thing that was interesting here, it was not just my experience from a conference where people are asking me, oh, am I going to lose my job? Which, after you hear it several times, you're kind of like, if you're in this space, like if this is an area of your expertise, you're thinking like, why? Again, the same question. But here it was done with various healthcare professionals. So this study is from Bangladesh, but the concerns that they are addressing here are universal, totally universal. And I'm going to just interrupt for 1 second because I don't see too many comments. Guys, come on. Show some interactions in the chat. What do you think? Are you afraid? Are you confident? Are you using AI? Are you not using AI? Let me know in the chat. What are your thoughts? Okay, so they did this. Study design. In this study, a descriptive and exploratory research design was adopted to investigate healthcare workers and viewpoints concerning the potential substitution of human medical professionals with AI, right? So their apprehension and viewpoints. But what I wanted to highlight is that they were drawing upon that acceptance model, technology theory, and socio-technical systems theory. So these are like sociology and psychology theories when it comes to introducing new tech. So they're apparently like investigated ways that people react to this. It's not specific to digital pathology. It's not specific to medical AI. It's any piece of technology that comes into our life. There are like certain psychological mechanisms that are being that are in play, right? So they investigated these mechanisms, and what were the demographics of the people that were investigated? So very cool tables, semi-structured interviews, and who was these people? Who were these? So this is a nursing journal. So I expect there's going to be a lot of nurses. So nurse, hospital administrator, physician, medical technician, nurse, physician, technician, nurse, physician. Who else? A radiologist, some radiologists, pharmacist. Interesting. A couple of pharmacists. Physician, pharmacist, medical technician. Okay, so this group, and obviously gender, highest education, years of working. So they also like had a very diverse group that they investigated. And they had structured interview focus group discussion outlines. They had like 7 different things that they were addressing. So, number 1, how would you describe your current role in the healthcare industry? And can you share any experience or instances where you've encountered AI in your work? And then, what are your primary concerns and apprehensions, right? So, they were asking about like the negative stuff. This is what they, let me make this bigger for you. Is this, oh, sorry. Yeah. Okay, that should be fine. Okay, so apprehensions regarding the potential replacement of medical professionals by AI. How do these concerns relate to your daily work? In your opinion, what are the key ethical and societal considerations that need to be addressed when integrating AI into healthcare? And how do these considerations influence your concerns? Can you provide examples of ways in which discussions about AI have influenced the dynamic and relationships among healthcare workers, patients, and within your healthcare institution? How do you envision the future of healthcare with increasing presence of AI? What measures or strategies do you think should be in place to ensure a smooth integration? See, they don't even ask like, oh, do you want to like get rid of it? No, it's integration. Smooth integration addresses healthcare workers' concern. And what recommendation or insights can you offer to policymakers, healthcare organizations, and professionals? Right? Let me just drink some water. So I'm gonna make it smaller because there's a cool picture I want to show you. Okay. And here were the concerns, right? Ethical and moral dilemmas. Nothing new. Nothing new. We are all like, is it good? Is it bad? How is it going to affect? I have some comments from Thomas. Thank you, Thomas. I was counting on you. I thought if you are live here with us, you're going to write something. And I'm going to get to it in a second. Let me just go through this image. Yeah, so job security and economic concerns, very important. This had already effects in reducing, where with AI assistance, it's kind of like in the model of American healthcare, where you have like fee for service, the more service, the more the fees. I think in radiology became services, and that's a whole can of worms. Workforce role and definition, trust and acceptance of AI, healthcare population, patient provider, the relationship, quality of patient care, right? So this one is important because, okay, can you trust it? And it was reliable. That's a big one here. Like a lot of, so this is like a combination of these two, ethical and moral dilemmas. Then okay, what is our role then if like this AI system that does stuff for us, are we then supposed to be like very tech savvy? Like how does the healthcare worker profile change? And yeah, let me just check the tables. We're gonna go back to it. But yeah, I wanna check. Well, Thomas's comment is long, so I'm gonna just read it to you because it's an interesting. I want to show myself interesting discussion point. Is using AI and find AI very performing in some specific tasks, but not so intelligent globally. I like this perspective a lot. And so simply it means we will work quite to very differently. But at the end of the day, we will be the guys signing in the diagnosis. So yeah, that's for pathologists. Let me read the rest of it. So yeah, that is an important point because all these tools are supposed to help us, right? And the deskilling experiment also, like, they didn't say, oh, we're now like gonna take away this AI. And that's like kind of a theme as well. The doctor with AI is doing better than the doctor without AI. Before learning AI. We just learned that the doctor without AI when they were already working with AI. That's even worse than at the beginning. So just keep having them with this AI, right? Like me with Google Maps, or my friend with the car, the stick versus automatic. Mm. So it's going to be a partnership. There's still so the liability questions, right? Sometimes it's very complex, but the person signing out is going to be still the main person responsible. But if you're using a tool that you are not involved in developing and like it fails, there's going to be a gray zone. Yeah, and the comments I get from Thomas is that there's a lot more intelligent, smart, critical review and decision making. That's going to be our work. Come on. Come on. And yeah, thank God it's Friday. Thank you, Thomas. I know it's like heavy topic for Friday morning or afternoon, but yeah, concerns. What I want to say is in this picture that I just showed you, the policy makers. No, and some other were like, what will the policymakers do? Because that's ultimately their role to. So the NCCN Guidelines Summit on AI in healthcare was supposed to basically address that. They were different stakeholders, including patients, including everybody involved in cancer care, and they were discussing, like, they were having questions, they were discussing, and then NCCN policy experts are gonna issue a report based on this. And then the regulators, the institutions, the organizations are going to take it and think, okay, how can we guide the healthcare professional the smartest? And we actually will have more expertise with AI. I think so too. Like, we're going to be better with the tool. Like, obviously I like these tools, right? And I use them as much as I can, but also in the back of my head there's this question, okay, I don't want to be stupid, so what do I need to do in another area of my life to keep my brain active and thinking critically? So when I use these tools, I do engage with them. I very much critically read everything that this the chat GPT, Claude, or I puts out, because it produces nonsense. If you've seen me do one of the book live streams, oh my goodness, what nonsense it produces. And then you ask it, oh, did you like invent this? Oh yes, I'm sorry, I fabricated this part of the book. And I'm like, yeah, I know, because I have enough expertise to know that it's fabricated. But basically, like, the critical engagement and with the tools, but not all the tools are text-based. Not all the tools are explainable like that. I mean, explainable. I don't know how this text was generated. I mean, kind of know with like a transformer architecture, but I can verify it because I can read and I can understand. If it doesn't make sense, then I'm not going to put it in my article, right? This is like easy cognitive check that I can do. As a pathologist with a computer-aided diagnostic tool that shows you some area with a specific diagnosis, if you disagree with this diagnosis, you have the expertise to say no, right? And if you see like 5 no's in a row, you might go to whoever deployed the tool and say, hey, this tool is underperforming. So we have this level of potential intervention if we pay enough attention, and we should, because we sign out whatever our work is, right? It has our signature, be it pathology report, be it an article that you write, be it a book. And now it's time for the book promotion. Let me put this, let me give you a QR code that you can scan. So when you see this QR code, you will get the digital version of this book. And the book is Digital Pathology 101 for everybody who's starting their journey in digital pathology. It's a very cool resource because you can get up to speed very fast, not that long, currently 132 pages. It's going to be longer because I'm updating it, but worry not, because if you get the current digital version, you are already on the list of my email subscribers, and you're going to get the new version as well, with updated AI information and everything that happened since the first edition was published in 2023. And I am committing to publishing it before the end of 2025. It was supposed to be this month. I'm actually this month, so that you can get the new version, but get the old version anyway, because then you don't have to like sign up for anything else, and you're already on my list. So yeah, let's do it. Because one of the conclusions of the nursing paper will we lose our job, or is it like 1 years of training and expertise will be devalued by machines? Devalued. I think I like butchered this word. One of the like recommendations and requests by the healthcare professionals was training. What happened here? Training was the main thing that they were requesting. And there's another comment by Thomas that these tools, these AI, whatever it's going to be, software assistance for robotics or whatever, they are tools that allow us to be more critical. Like, a tool is not going to get offended when you like double check it and like critically, like when I work with these with chat GPT, right? I'm not gonna feel bad that I'm asking it for the 7th revision. If I was working with a partner on a publication, at some point I would be like, let me write it myself, or like, stop interfering so much. In this case, like, I am the guide, right? And I can have it the way I want to have it. So lots of time in the olden days, it was a lot of time to make great quality manual analogical work, and we ended up having less time to make high value work. I totally subscribe to that one. And also, if you have something, like for me, I think it's invaluable because I want to put out a lot of stuff for you. You all, like, this is my mission to help you understand digital pathology and medical AI so that you can do your job better, so you can feel more confident, so you can be in the know, and like, after reading this 100-something page book, you can go to your meeting and contribute, right? And so to do that in the fast-paced environment, I very much leverage these tools. And thank you so much for this fantastic discussion. If somebody, I need to show you where I'm going to be at Path Visions. Let me share my screen with you. Path Visions. Let's see. Okay, we have Path Visions. Shoot. Stuff happened here. Let me go back. Okay. I do want to share my screen. Share. It's doing some funny stuff. Okay. I'm just going to show you who is going to be there from my supporters and where are they going to be. Okay, so Barco. No, let me do full screen. Sorry for that. I know what I need to do. I need to take this to a different screen. That's not going to do any nonsense. Let's do this. And thank you so much for scanning the code for the book. They're amazing. You were like, really are. I love doing these live streams. It's the 29th Digipath Digest that we've been doing. So there is something to it. Okay, bear with me because I do need to tell you where I'm going to be. Okay, so fantastic. Here, Barco booth 314. You're going to find me there for sure because we're going to be creating some social media content. And if you see any content from the Barco booth, give it a like, give it a comment, say hi, whatever. Just let the algorithm take it further. Then, who else is there? I think booth 400, Apridia. They are digital pathology sponsors, so I'm going to be visiting them for sure. Grandium, my friends, today the Grandium, the video about the new Grandium scanner is coming out. So if you're going to Path Visions, and you can then watch the video if you're on my list, because you're going to get it today, and then go and check this super cute scanner. I already have it packed in the box, but I'm going to show it to you in this video. It scans 4 slides. I don't even remember. 4 or 5. I think it's 4 or 5. Okay, now I have to check it because here I'm spreading misinformation. Let me check. Let's see. 1, 2, 3, 4. I think it's 4. Yes. Okay. So there's going to be an unboxing video with the scanner, right? Then who else is my friend here? Oh, shout out to Lumea, because we just came back from their summit and it was a really good event. So if you are looking for something where you can connect with decision makers, like in a pretty intimate setting, that would be the summit, the conference to go to. Very intimate, like there was around 100, I don't know if even 150 people, and we had these excursions. I don't know if you've seen my ATV video from last year, and this year we were riding horses, so you connect with pretty high level digital pathology and medical AI achievers. So if you want to learn more about this, booth 208. And Intuitive, we're going to be recording a podcast together. And this is booth 46. And Roche, booth 401. So next to Apridia, my two sponsors are together, so I don't have to like a lot. TechSite, we recorded a podcast recently in March at the US Cup, but they are my sponsors, so I'm going to be visiting them as well. So yeah, 400, oh, the 400s, 412, 401, 400, something else. Anyway, that's where I'm going to be. And if you see me walking with the camera, just say hi. Like you can tap me on the shoulder and say, hey, I'm a trailblazer, and then I will know who you are and you know who I am. And if you just are not listening to this, then yeah, let me just stop talking. Anyway, guys, thank you so much for joining. You are amazing. You make me want to keep doing this. And okay, the QR code, I see some people had trouble, but I think it's working. So also, if this code is not working, you can always go to digitalpathologyplace.com, and there's a button to get the book. If not for you, if you already have it, or if you're like an advanced digital pathology trailblazer, just send it to someone. They will appreciate someone who is just starting their journey or have expertise in a specific area, but want to learn about more areas. And if you are interested in learning more about AI, we have a code, Path AI, Pathology AI Makeover. It's a new course that I created. It's already updated, so the like some of the information from the course is going to be in this book. This one is paid, and also you can just check everything we have in the digital pathology store that is recently launched, and obviously in the store you can get the earrings. Earrings are not gonna come before Path Visions, but definitely before your next conference. So this is my favorite because this is the multinucleated giant cell. I don't know, I just love this cell. So beautiful, so ineffective because too much. Multinucleated giant cells are the macrophages that come together to eat something that's killing them, and yeah, it's overwhelming, so they're not too effective and they just sit there, but I somehow like how they look. And we also have cartilage, and we also have this pattern, which is Alcyon blue stain of colonic. So probably that's going to be mostly female trailblazers, but if you want to give it as a gift, fantastic as well. What I asked the DPA, did it last minute. I asked if I can bring them to Path Visions and basically have a part of the revenue from this be a donation to DPA. Let's see, maybe they're gonna be there. If you're there, I hope to see you there as well. Thank you so much for joining me. Stay as you are a true digital pathology trailblazer. I hope to see you and talk to you in the next episode. Thanks so much, guys. You are